This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson with you for Mon Health Talk. Our guest this morning is Barb Menear, Diagnostic Imaging Manager, Mon Health Preston Memorial Hospital. And we'll be talking about 3D mammography coming up this morning on the show. But first, let's welcome in Barb Menear. Good morning, Barb.
Good morning.
Hey, thanks for taking a few minutes and spending a little bit of your Monday morning with us. We'll get into the topic at hand here in just a moment. But we like to get to know our guests just a little bit before we jump into it. So tell us about yourself, your background, where you come from, your education, training, and the full, well, it doesn't have to be the full biography, Barb, but give us the short version, if you will.
Well, I'm a local girl. I grew up in Arthurdale, and now I live in Reedsville. I did my education at WVU, so I stayed close to home, and I spent a lot of my early career at WVU Medicine. About 5 years ago, I had the opportunity to come to Preston Memorial, which, of course, is a local hospital for me. It's local to where I live. So I had the opportunity to come back into my community and hopefully, help out some here and get back into the community and do some education and help out close to where I live.
What drew you to this career field in the very beginning?
I think it was always the desire to help people. I'm kind of a people person. I like being around people. I like helping people. So that led me into the healthcare field. And radiology is kind of a hidden secret, if you will. We laugh and say we have some of the coolest, most expensive toys in medicine that are out there. Technology is constantly changing, so it's different all the time.
We hear that almost every week when I get to talk to these guests every week, Barb. It always boils kind of back to wanting to help people and the relationships and the people you get to meet and the people you get to help. And I think just about everybody I've had on the program has some version of that story in the medical field.
I think you're probably right.
So we're going to get into 3D mammography today. I think I'm saying that correctly, mammography. What is that is the short question.
So 3D mammography is, mammography's been around a long time. Mammography came onto the scene back in about 1976, about 45 years ago. And at that point, it was with film screen like all other X-ray. Then along the line, we moved to digital mammography, which was leaps and bounds better than what we had before. It allowed us to detect breast cancer on a more consistent level. And then around 2011, 3D mammography came onto the scene. And that is just, again, leaps and bounds better. It allows us to detect it when it's small, which is what we want to do, because it's, of course, better treated at that point.
You kind of started down my next question was the advantages and what makes this so much better than the previous technology.
Yeah, so 3D mammography, what it does is it kind of peels back the layers of the breast tissue, if you will, to let us see what's in there. Several years ago, I saw a little video clip, if you will, of it had about 25 women in it, all dressed in white. So that's all you saw was this clump of women dressed in white. And as they started walking away one by one, you saw that hidden in the middle of there was a lady in a red dress. But you could not see that till you started peeling the layers away, which is kind of what we do with 3D mammography.
So you can find those, like you said, those little areas of concern. I don't know how to... I'm sure that's the medical term, but you can find that. And the earlier you find, just like any other cancer screening, the earlier you find it, the more treatable and the better the outcome, right?
Correct. Yes. We want to find it when it's very small and very early.
So how old or at what age do you recommend women begin getting regular mammograms?
For most women, that would be around 40 years of age. We do really encourage women to discuss this with their healthcare providers because based on their family history, they may want them to start a little earlier, but their healthcare provider is the best one to tell them what is the best age for them to start getting mammography. We do want to reassure people because we know some people with COVID have put off their preventative health maintenance, and we do want to encourage people that, we are cleaning to the highest standards. We're taking all the precautions. It is safe to come back to the Mon Health facilities and start getting those preventative exams again.
Now, has the 3D mammography completely replaced the old technology, or do you use a mixture of both? How do they coexist?
They do coexist to a certain extent. But we have found that 3D mammography is beneficial to all women. When it first came onto the scene, they were saying it was basically for women with dense breast tissue. So usually that is your younger women. Some women have dense breast tissue all their life, but that was the main focus of it. But what we found over the course of it being out there is this is beneficial to all women, no matter what their breast tissue makeup is.
And Barb, I've never met a woman who said, boy, I'm excited to go get my mammogram today. I've been looking forward to this. I've never met her. She might be out there somewhere, Barb. But what is the process, and can you ease some of the fears some may have? Because, its reputation precedes itself. Let's put it that way, shall we?
It does. And I don't think you're really probably ever going to find a woman who's excited about having it done. I will say that a lot of women don't understand the reason that we use the compression, and that is so that we do get a clearer image. Without the compression, it's not really crisp, it's not really clear, and again, we are looking for those very small nodules or microcalcifications, so that's what the compression is for. With that being said, it should not be painful. It probably will unfortunately be uncomfortable, but it's bearable, and your mammographer will work with you through it, communicate with her, she'll communicate with you, and we don't, ever want to cause anybody any unnecessary pain. So we'll work with you through it. And most women at the end of it say, you know what, that's not as bad as what I had it worked up in my head to be.
That's probably a compliment at the end of the day, isn't it, Barb? Well, it wasn't as bad as I thought it was going to be.
Yes, it is.
We're talking to Barb Menear, Diagnostic Image Manager, Mon Health Preston Memorial Hospital. Our topic today, 3D mammography, and we'll continue our conversation. But first, we need to squeeze in a short break. We'll do that now. It's Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest today is Barb Menear, Diagnostic Imaging Manager, Mon Health Preston Memorial Hospital. We've been talking about 3D mammography this morning. And Barb, where can patients get the 3D mammograms done?
Well, they can get 3D mammograms at any of our Mon Health facilities in Morgantown, Fairmont, Kingwood, Grafton, and Weston. What a lot of people don't realize is no matter which one of those facilities they go to, they're getting the same group of radiologists who are the doctors who interpret those mammograms, those images. Those are the same group of physicians at all of those locations.
Do you get your results that day, or is it a couple of days to read those? How long does that take?
Well, here at Preston, I'm going to speak for Preston.
Sure.
Here at Preston, we do give results same day most of the time. If they have an outside, a lot of mammography is comparing to old images if they've had a previous study somewhere else. So as long as we have all of those studies and we have them here to compare with, we will give same-day results to women.
If something pops up that catches your attention, what do you do at that point? And what are the steps at that point in the process?
When we call the patient back that day with the results, we will go ahead and tell her, there's something here that we want to take a little closer look at. We know that always makes people worry. Lots of times it is simply just a closer look and everything is fine, but we will need to bring them back in. So what we will do is we'll bring them back in as soon as we can. We'll do some further imaging with that and take a look while the radiologist is here and, determine does she need anything further, or were we able to make that spot appear less suspicious? We got a better look at it. I will say with 3D mammography, those callbacks, is what we call them, are reduced by 10 to 42% with 3D mammography over our previous imaging technologies.
So if I understand you correctly, with the previous technologies, oftentimes, I won't say oftentimes, but it sounds like they're often enough, something pops up that turns out it was nothing, or a deeper scan, a better scan can catch or can tell you better what you're looking at. And again, ignorant terms here. Barb, I apologize.
You're fine. And basically what we were trying to do with that old technology is because we weren't able to peel away those layers like we were talking about earlier, when we would bring the woman back in, we couldn't really see through it. So basically what we were doing was applying compression in a certain spot. And basically the concept is if we can make it go away, there's nothing really there. So we would try to spread that tissue apart because lots of times it was just tissue laying on top of tissue. But with 3D mammography, we're kind of able to peel those apart without having to do that additional imaging.
Why is it so important that this is part of your yearly healthcare routine?
So again, it goes back to detecting cancer early. When it's detected early, it can be treated. It's and successfully treated. Breast cancer is one of the most diagnosed cancers that there are. There's a 1 in 8 chance of a woman developing breast cancer sometime in her lifetime. So, of course, as she gets older, that chance goes up. But we want to catch those early, and we want to treat people.
Yeah, chances are, and speaking from a guy's perspective here, Barb, you probably will at some point, a woman, you love, whether it's your mother, your sister, your wife, your aunt, whatever the case may be, cousin, you're probably going to be touched by this in one shape, form, or fashion at some point, aren't you?
You really are. And the next time that you're in a group of women, of 8 women, you can look around and one person in that 8 is probably going to be affected by breast cancer at some point in her lifetime. We always like to, when we go out to do education, is we try not to just educate the women. We try to talk to their loved ones, their husbands, their sons, their, friends, to please encourage the women in your life to go have her yearly mammogram or at the pace that her provider has told her that she needs to have them so that we can take care of this. 75% of women who get breast cancer are at an average risk for breast cancer. So they don't really have any family history of breast cancer.
Oh, wow. Talking to Barb Menear. She is Diagnostic Imaging Manager, Mon Health Preston Memorial Hospital. It is quite common. With it being so common, are we better educated these days than we were 20, 25 years ago? Are we doing better in the early detection, preventative? I don't know if preventative maintenance, that sounds more like we're talking about a car, Barb, but you get what I'm saying. Are we doing better in that area of getting out in front of these types of ailments?
I think we are in a couple different ways. I think we are better educated. I think shows like this and like people talking, I think we do a better job of getting people educated, but I also think the technology has advanced so much that 25 years ago, the cancer had to be a lot bigger in order for us to see it. Now we can pick it up when it's very, very small, and it's much easier to treat it, and with less invasive techniques of treating it also.
I'd never kind of thought about it from that perspective, Barb. Obviously, we talk so often on Mon Health Talk about the less invasive procedures that are available for treatment and prevention, but I never thought in terms of cancer of it 25 years ago, it had to be a certain size to even be able to see it on some of the technology that was available. Now, it can be much smaller, and again, that goes back to the first thing you mentioned off the show. The smaller it is, the earlier it is, the better off you are.
Exactly, yes.
Barb Menear is our guest this morning, Diagnostic Imaging Manager, Mon Health Preston Memorial Hospital. We'll continue the conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a couple of minutes left. Barb Menear joining us, Diagnostic Imaging Manager, Mon Health Preston Memorial Hospital. Been talking about 3D mammography this morning. And Barb, I want to make sure before we run out of time, do patients, will they need a referral to come see you? Can they make an appointment on their own? How do they go about that?
Yes, they will need an order from their healthcare provider, so they can get an order, and then they can just call us to schedule. monhealth.com/mammogram. There's all kinds of information there, directions, phone numbers to schedule at your local facility, or just give us a call and we'll help you.
And like you said a little bit earlier, these are available Morgantown, Fairmont, Kingwood, Grafton, Weston, and it's all the same radiology team working all these locations, correct?
Correct.
What do you want patients to take away from our conversation, or just folks in general who have been listening in today? What do you want them to take away?
I just want them to know that we are so excited to have this technology across our system. We're excited to be able to offer it, and we want to put women's fears at ease. Come in, don't be afraid. Come in, we'll walk you through it. We'll be with you every step of the way.
How new is this technology? How long has it been available across the Mon Health system?
Mon Health Medical Center was the first to have it. And honestly, I'm not really sure when they've had it for a few years now.
Okay.
Grafton put theirs in a few years ago. Preston we just received ours in April. Stonewall down in Weston, they also just put theirs in right before we did. So we're still very excited to have this technology and be able to share it.
Well, it's great, Barb, that the technology is available in our own backyard. You don't have to make a trip from Grafton to Morgantown or drive in from Kingwood to Morgantown, or even have to go on to, one of the big cities, as we like to say in West Virginia, Barb, to get these done. These are available in our community hospitals, and I know that's something Mon Health has stressed a great deal over the many years.
Yes.
Well, Barb, thanks for taking a few minutes with us this morning. I appreciate the conversation, and folks can find more information. Go online to monhealth.com/mammogram for more information there. Barb Menear, Diagnostic Imaging Manager, Mon Health Preston Memorial Hospital. Thanks so much for the time this morning. I appreciate it.
No problem. Thanks for having me.